Good afternoon, everybody. I'm welcoming you to the Wellbeing, Health and Youth Seminar of June. And I'm just want to first off say that this is part of the seminar series for the Wellbeing, Health and Youth NH and MRC Centre of Research Excellence in Adolescent Health. And just that we acknowledge the support of the NH and MRC and also our research partners across different universities and the Commonwealth Government. We all acknowledge the traditional owners of country throughout Australia and recognise continuing connection to land, waters and culture. And we pay our respects to their elders past, present and emerging. Now, just a quick reminder that we have the WH&Y Community of Practice website where you'll find all of the past seminars that you can have just a scroll, browse through, pick the ones that you enjoy. We have quite a library of those and all of the up-to-date resources that we become aware of and also that our research is producing. Just to remind everyone about the chat function, so you're all muted. You can't ask questions verbally on this platform, but you can please put in lots of chats, whatever you like, and also questions as we go through the seminar. Just put them up there at the, it's actually at the bottom right. You can actually type your questions at the bottom right, but it's on the, yeah. And then at the end of it, we'll highlight the questions that we can get to. So thank you for your contributions to that. And I'm really very pleased to introduce our speaker for this month, Brianna McCoola. Brianna's the Principal Project Officer of the Queensland Child and Youth Clinical Network. And previously she worked as a radiation therapist in adolescent and young adult oncology for more than 15 years. Brianna's passionate about improving the experience of care and health outcomes for young people across Queensland. And she values and prioritises collaboration through co-production with health professionals and consumers. Brianna was the lead author and facilitator of Optimising Adolescent and Young Adult Care in Queensland strategy. Now, just before Brianna starts her talk, which she'll kick off with the next slide, I probably should introduce myself. So I'm Professor Rachel Skinner and I'm the Deputy Director of WH&Y. And I'll be hosting these seminars over the next number of months while Kate's on leave. So anyway, thanks, Brianna. You can take it from here.
Wonderful. Thank you so much, Rachel, for that lovely introduction. Good afternoon, everyone. Thank you so much for joining us today and to the WH&Y for inviting us to speak. My name is Brianna McCoola. I'm a clinician and probably call myself a novice researcher. In the area, my energy, I love working with adolescents and young adults and particularly have really enjoyed my time with the Queensland Child and Youth Clinical Network on this work. So today I'd like to present the Optimising Adolescent and Young Adult Care in Queensland project and co-design statewide strategy. The Queensland Child and Youth Clinical Network, or QCYCN, as I may call it at some stage during this presentation, are a collaborative of clinicians from across the health sector and system in Queensland that have been working really hard since 2020 to champion the needs of youth in health, with the ultimate goal to optimise the care that all adolescents and young adults receive in Queensland. And so before I would begin as well, I'd really like to pay my respects to the traditional custodians on the lands on which we are all here today, on which we work, walk, talk and live, and acknowledge and pay my respects to the Aboriginal and Torres Strait Islander elders past, present and future. For me here in Brisbane, that is the Yuggera and Turrbal people. So thank you so much for your knowledge and wisdom to guide us, particularly in this work. Before I go any further, I've got a little video that I'd like to start off with. This is just a little bit of a very short resource that we created last year to complement the work that we had been doing. It was co-designed or authentically engaging young people in conversations about their experiences and what they believe quality adolescent young adult care is. And from those beautiful interviews with a group of young people, we were able to craft a bit of a promotional resource. So I'll just play that now.
I would often have to navigate the healthcare system on my own and would know enough to understand that there was more I could get out of the healthcare system. Even from the very start, whether it was with the GP or it was with the mental health care professional, I wasn't being listened to and I wasn't being heard in terms of the issues that I was going through, not even to mention the difficulties of accessing care at almost every point.
I think the concussions for me were extremely stressful. You know, I didn't have my parents here. I put up with one of the most stressful experiences of my life, and I didn't really know what was happening, didn't really know what we were doing, didn't know where we were going, didn't know what was going to happen if I had to stay the night, if I could go home or anything.
It's really easy for me to access psychoactive drugs, but it's very hard to find someone who's willing to listen and have a conversation with me and believe me.
I felt that I wasn't guided in the direction that I needed to be guided in order to get the answers and to access that level of healthcare that I really needed.
I actually found a lot of the difficulties were the amount of information that was given to my parents as opposed to me, difficulties with not being given the complete picture, not really being provided enough information to choose between services.
I need to feel like I have all my options on the table. I need to feel like I know who, how, where and when to access a service and how those services actually work.
Encourage me to help myself rather than tell me what to do. Yeah.
Young people are emerging into their own agency and developing their own independence. And then if you're transitioning immediately from a pediatric framework to an adult framework, you're not actually providing the individual the skill set to move from one system to another. So I think it's about recognizing the stage of life. I think it's about recognizing the different illnesses that people experience at that age compared to when they're children or adults. And also recognizing that a little bit more proactive support can be required. And it's not necessarily a failure in the young person or a reflection of their health status. It's just a very normal response and a very normal support required for that age group so that they can eventually become fully independent within the adult system.
Having everything there to support people transitioning between those stages of their life, that is crucial because so many things change in that time frame. Your body's going through hormonal changes, you know, that can affect symptoms, that can affect medication dosages, treatments, consent changes as well. There's a lot of different things in that area that really just glazed over. So, you know, helping to create better processes, transition of care, and educating people on how to communicate to that demographic, I think it's so crucial to help you then manage your healthcare further as an adult and for better healthcare outcomes overall.
And so we hope that little video resource is just a really nice reminder, I think, to the health system that what young people in the majority want from health services is not infrastructure. It's not independent hospitals that, you know, just have adolescents and young adults in it. It's about having developmentally adapted and appropriate care that is supported during these years, as they're not only, you know, interfacing with the health system, but also growing into adulthood as young people. So, yeah, it's a beautiful little resource, and we are absolutely, you know, so thankful to the young people that contributed and were a part of that part of our project. So, yes. So, first off, I just thought I might provide a little bit of a background around Queensland Health, and from a systems level, I've learned a lot over the last 2 years, I suppose, in the difference between healthcare systems and structures around Australia. In Queensland, we have 16 independent hospital and health services across our state. And so each hospital and health service is its own entity under the Department of Health. So you can see here on the left, I've got a little bit of a graphic here around who are the Department of Health and what sections are there within it. So the Department of Health has lots of individual sections that look after different pieces of the health system. And within the Department of Health, they also have the hospital and health service boards that then flow down into each hospital and health service that we have in the state. So essentially, we have these 16 independent entities within Queensland that are all commissioned and all receive funding from the Department of Health, but are, in a lot of ways independently operated. The Queensland Child and Youth Clinical Network sit under Clinical Excellence Queensland, which is about 4 down on the left-hand side in the green box. Clinical Excellence Queensland has a network of clinical networks that have been set up since the early 2000s. These clinical networks are really that mechanism within our system to encourage cross-sector collaboration and cross-HHS collaboration. The majority of the clinical networks are stream or discipline based, but we are population based with the Queensland Child and Youth. And so within our clinical network, we have our membership, but then we have that governance pathway up through clinical excellence within, and then through to the Director General and then the Department of Health. And the journey that Queensland has been on over the last little while has been one of great growth. From approximately 2010 to 2020, there were some incredible, really strong discipline-specific or location-specific initiatives happening across the state that were taking best practice evidence and applying quality care for adolescents and young adults. But they were isolated. And they weren't as interconnected as I hope that, potentially if we took a diagnostic across our system now with the work that we've done, that there is some more connection between these pieces of work. Some of the initiatives that were really strong were out of oncology with the Queensland Youth Cancer Service, which I had been a part of clinically before coming into this role. And areas such as mental health have led the way for a long time in providing developmentally adapted appropriate care to adolescents in Queensland. Diabetes and renal have also done really excellent things to try and advance the agenda of young people within health. In 2020, Clinical Excellence Queensland, with these clinical networks, they have a mechanism to hold a clinical Senate meeting. And they hold these 3 to 4 times a year, and they tend to be around topics that are being brought up within high-level strategic meetings as pinch points in our system. And so in December 2020, the Clinical Senate hosted the Adolescent to Young Adult Care Doing Better meeting, which saw clinicians again from paediatric and the adult sector and right across the system come together to talk about how the system was going and how care was being provided to adolescents and young adults. We had the incredible Dr. Susan Sawyer provide a keynote address via Zoom in December of 2020 with the environment that we were in at that point in time with COVID. And she was really able to elevate the evidence around adolescent and young adult care, and that potentially some other states and territories are much further along in their journey in being able to optimise and improve care for young people. The Clinical Senate came out with a list of recommendations, and from that, the Queensland Child and Youth Clinical Network were able to garner some funding to execute potentially or start the journey towards execution of a couple of these recommendations. And Dr. Lucy Holland preceded me in this position and was incredible at bringing together some of the pieces of work. And then I've been on since sort of September 2021. And so, as I said before, there's these 26 clinical networks across the system. The majority of them are stream or discipline specific. There are some population ones. There's the rural and remote clinical network. the Queensland Aboriginal and Torres Strait Islander Clinical Network, and ours, the Child and Youth. And the role of the clinical networks is really to be that collaborative lever for clinician expertise in the system, to share research, to promote partnership, and to execute and review evidence-based and best findings, and be that voice of reference through to the Department of Health on specific topics. This is our structure, the Queensland Child and Youth Clinical Network. So we are one of the biggest clinical networks in our system currently, from what we understand. We then have sub-networks that sit underneath our clinical network. So specifically the adolescent and young adult sub-network was formed under Dr. Lucy Holland when she was in the role, and continues to be a strong, incredible force today to really advise and work on all of the efforts that QCYCN produce when it comes to youth health work. We also have the Child Health Subnetwork, the Child Development Subnetwork, the Digital Child Health Subnetwork. We have the Paediatric Palliative Care Working Group, School-Based Youth Health Nurse Subnetwork, the Paediatric Palliative Care and Haematology and Oncology Clinical Network. And we did previously have an Aboriginal and Torres Strait Islander worker clinical network as well, but this one is currently just going through a little bit of a restructure. So our goals for adolescent and young adult healthcare really around creating that statewide, all of HHS collaborative multi-sector approach, and not just being from public healthcare, that being from private, primary, tertiary and NGOs as well. We really strive to elevate the evidence base and do that through the collective expertise of our clinicians. We are very much a knowledge sharing and confidence building platform, we hope, and really try to empower clinicians and make sure that we are putting forward those really strong advocacy efforts through to the Department of Health. This is particularly important, I think, in Queensland because we have the incredible quaternary Children's Health Queensland that is AHHS within Queensland. They provide statewide services, but there are then all the other HHSs that do have their own paediatric services as well. So we really strive to make sure that we have got that statewide collaborative voice through to the Department of Health that works with Children's Health Queensland as a hospital and health service entity, and elevates the needs of all children, families, children, infants and young people into all of the work that we try to do. And so this was the Clinical Senate in 2020. It came out with these recommendations, listed these great recommendations that it would really, I bet our system would really benefit from actioning. The Clinical Senate is, again, a collaborative function within our system and doesn't have any funding levers as such to be able to execute the recommendations. The first key recommendation was really around the co-design of a statewide system level strategy that clearly defined the adolescent and young adult group, address the care that they're currently receiving, provide the evidence around what care they should be receiving, and also really promote that shared language within our health system. There are other recommendations there as well, including a systems level framework for adolescent young adult services, supporting transition of care, education and training was really key to come out of the Clinical Senate meeting as well, because health professionals very much report that they often feel out of their depth potentially, or don't feel as up to date with the information that they really need to advance or improve their practice when working with young people. So the Queensland Child and Youth Clinical Network sort of got straight to work. We were involved in the creation of those recommendations from the Clinical Senate. And so we were given a small funding envelope to start the process. And first off the rank was that shared definition, and being able to contextualise the evidence, international and national evidence, contextualise it and check it against Queensland, and really gather that expertise through the AYA subnetwork to inform this foundational document. And so Dr. Lucy Holland was the lead author of this AYA care position statement. And this underpins everything that we do, and that every young person 12 to 25 years should have access to developmentally appropriate quality adolescent young adult care, regardless of where they live or receive care, whether that be mental health care or physical health care. And the ultimate goal is to make sure that young people are able to access this in all parts of our healthcare system in Queensland. And then we had the excellent opportunity through the clinical networks. We applied for, again, a small funding envelope to continue and build off this position statement to co-design the strategy and really meet that first recommendation that came out of the Clinical Senate. And so Dr. Lucy Holland and myself, sat down and sort of started to work out how we were actually going to create this strategy to meet all of the markers that we wanted it to meet. And so we developed it using a co-design mixed methodology. And this was really important to ensure that the evidence that we gathered and the evidence that, is very much strongly put out through the literature is adapted and justifiable in the context of the health system across our state. The design of the strategy was done over several stages with focus groups held during February of 2022, which was sort of just after our, is that right? We're in 23, just after our borders open. And so it was during a bit of a peak wave of COVID, which made us a little bit nervous, but we were absolutely delighted with the buy-in that we had from not only consumers, but health professionals during that point in time. We used a PDSA cycle, and because it was really important for us for consumers to feel really comfortable to contribute their ideas and thoughts, we took this appreciative inquiry model to really talk about their experiences within healthcare, and whether that's within the hospital and health system, or whether that was in primary care or within NGO. Dream about what could be in the future, talk through those dreams and think about how we could design them within the systems that we currently have, and then actually be able to turn, those experiences and those dreams into recommendations that are tangible at a systems level within a sort of, Queensland health or a government strategic document. And so, yes, as I said, we ran these focus groups and the co-design methodology during that point in time in February of 2022. We were so fortunate that we had an excellent amount of young people, carers, health professionals and chief executives from right across the state. The CEs are listed, the CEs and the health professionals are listed in blue, and our consumers are listed in red. We had more than 5. It's just that we had multiple young people sort of from the same location in a few places. So the co-design process was done not only through the focus group, so we also incorporated a mixed methodology and also completed a statewide survey. So again, the survey was for young people, carers, health professionals or chief executives, and allowed people to participate if they didn't have the capacity to do a 3-hour focus group. The outcomes of these 2 stages were collated to inform the draft of the strategy, and the focus groups were facilitated by myself and Dr. Lucy Holland down the bottom there, but we also for the consumer focus groups, had the incredible Anya Christopherson, who presented with me at the AAAH last year. And so she helped lead the consumer focus groups as a lived experience facilitator, which was absolutely incredible to have her there to guide the conversation, and Lucy and I to really be able to ask more questions and delve deeper to try and get really quality data. I like to flesh out the consumer focus groups a little bit more. I think really to encourage other professionals to consider this approach if you do ever have the opportunity to co-design something with young people. The OPAC focus groups, we only held 3 focus groups, which doesn't seem like a lot. But that 9 hours of incredibly rich discussion gave us such an incredible base for a thematic analysis. As I mentioned, we had the lived experience facilitator and myself and Dr. Lucy Holland. We had 2 focus groups that were young people only, and we knew that that was really important for young people to be with other young people. But just because of scheduling and personal preference, one of the focus groups was a mix of carers and young people as well. We were really flexible with the time that we offered these focus groups. I think that the 2 consumer focus groups were at night time, going to, that 7:30 sort of mark after work. They were all online via Zoom. And as I said before, we had that statewide survey to support any participant who wanted to spend 10 minutes answering some questions instead of a longer period of time. The survey questions were a mix of open sort of questions, similar to what we asked in the OPAC strategy, but did also have a good amount of, quite directed sort of questions, with the option for the consumers to always contribute their own ideas as well. All of the work that we had done has gone through the low risk ethics application in the hope, or not hope, but with the idea that we will publish our results from this work in the future. And we had to fight a little bit, but we actually had ethics approval to engage anyone 15 years and older, which was a little bit of a discussion backwards and forwards with being able to get young people to participate in this work. I've also just got this little bit of a diagram. I'm just keen to represent, I suppose, that continuous feedback loop that WH&Y champion all the time in all of their work, in that, the consumers were there right from the beginning in the first conversations we were having about creating this strategy. And then we continuously fed back to them throughout the whole stages of creating the piece of work and the end product. And so what did the participants tell us? We asked consumers and professionals about their experiences of receiving or providing care to young people, and really what those barriers are within health for young people, and what opportunities they believed might work towards optimising care for this population. So young people told us about feeling unsafe, unseen, and not listened to. They felt disempowered when they engaged in healthcare, and that their concerns were either not important enough or not relevant enough or acute enough to gain the support that they really wanted. The young people were incredibly brave with the stories that they share, and they spoke about times when they felt like they didn't belong, and because they'd never seen someone else their age or didn't even think someone else their age may have the medical condition that they have. And so the health professionals across Queensland as well really echoed these sentiments, and sort of put out there that they, really recognised that their services in the majority didn't feel youth friendly or flexible, and they worried that young people get lost in our system and lost to follow up because of barriers that exist for the population. And so this is just another little thematic diagram, I suppose, demonstrating how we came to be at the final end product. We had the 81 participants in the focus groups with health professionals and the chief executives included. 107 participated in the statewide survey. And then we used those results of the 188 people in stage 1 and we looked at the evidence from all of the literature and matched it up against what we knew was quality adolescent and young adult care and where the system should be heading. From this, we developed the strategy, and so this was done in concert with the Adolescent and Young Adult Subnetwork, and particularly the co-chairs of the subnetwork worked quite hard on really refining the draft strategy before it went out for consultation. I had the big job of, I think we were sort of sitting at around the 110-page mark when I went to the co-chairs of the subnetwork and the co-chairs of QCYCN, and they were like, this is incredible and wonderful, but can we make it a 15-pager? And so doing that, taking something that was so big and robust and expansive, and still attempting to not lose the meaning and all of the evidence was definitely a challenge. But yeah, definitely something I would recommend, and I hope in the future I get the opportunity to, continue to refine my skills in this space. We then went out to community consultation, and it was a short but very mighty community consultation. It went out through the clinical networks, it went through all of the stage 1 participants and went out really broadly via email. And I think I sat and worked it out potentially how many email inboxes it hit, and it would definitely be at the 3,000 or 4,000 mark at that point in time. So this was in sort of late June of 2022. They fed back either via providing feedback on the document or via a survey as well, that they could feed back about what they thought of the actual strategy. And then we finalised the strategy in August, September. And so this is our Optimising Adolescent and Young Adult Care in Queensland strategy. It defines the recommendations, the statistics and evidence of healthcare in Queensland for young people, and it briefly defines what quality adolescent and young adult care is from the results from what the young people told us, the carers told us, and the health professionals told us in those phase 1 consultations. The strategies, the recommendations that were produced from the strategies, we define them into pillars. And so these pillars are optimising care for young people to really make sure that we're providing that integrated, consistent service across our system. The second pillar is maximising partnership and collaboration across our health services, to make sure that there are secure and navigated pathways, and they're so vital to improving the care we deliver to young people. It's also about maximising partnership and collaboration with young people and their families to make sure that what we are investing in as a health system is relevant and it's going to hit the mark. The Empower and Educate was another pillar that we pulled out because, again, we had this very strong evidence to support that health professionals feel at a loss providing good quality care to young people. And clinicians feel disempowered by the system. There largely remains in Queensland a lack of systems recognition around adolescents and young adults as a unique cohort within health. And so therefore there is a lack of recognition of health professionals with specialist skills that effectively work with young people. And then finally, systems change. In order to make progress in an embedded and resourced way, we have a list of recommendations as well for the system. The OPAC participants identified all of these recommendations. They really talked about the fact that they didn't talk about infrastructure. They talked about models of care, services, making or facilitating young people to feel more comfortable and more at ease when they come into our health system. The recommendations were all split up for immediate short term, short to medium term, and medium to long term. And the responsibilities for Queensland Health or the Hospital and Health Service, which is HHS, or health professionals or consumers have sort of been loosely defined, and provide a little bit of guidance around who's responsible for actually actioning these recommendations. We also put in there some very light, a bit of a anticipated costing key as to what investment these areas will need in order to be able to execute these recommendations. And as is sometimes the case, the strategy development did not come with a substantial funding envelope to execute the recommendations afterwards. I probably was a little bit hopeful that maybe there'd be a magic meeting that would come up after we had this endorsed, produced strategy that's been endorsed by the DG of Clinical Excellence Queensland, and that suddenly there would be a bucket provided to us to help the Department of Health consider how we can execute these findings. But one day we hope that this document will still continue to guide the health system to move to where it where the people who have participated in creating it have really told us that it needs to go to make care better for young people. So Queensland Health is really encouraging of using the existing systems levers, particularly through the Queensland Child and Youth Clinical Network, to continue to execute this work. So we've been supported with the carriage via the continual funding of the Principal Project Officer, Adolescents and Young Adults in Queensland, which is the position that I'm in. And I'm happy to say, which I only probably found out a couple of weeks ago, but that has been supported into 2023-24. So we will continue to have the opportunity to execute this through the FTE with the Queensland Child and Youth Clinical Network. My work or the work of QCYCN and the AYA subnetwork have also been very much supported to execute any of the no-cost recommendations or tweaking any of the low-cost recommendations to find a way that we might be able to achieve them with no cost. So we are being encouraged to keep doing the work. We just haven't quite got that, as we all would like, a big bucket of money to be able to really make some embedded big systems changes. These bodies of work that we have worked on since publishing the strategy were a couple of those recommendations that came out. One of the key recommendations in the Clinical Senate and in the Optimising Adolescent and Young Adult Care in Queensland strategy was moving towards some systems recognition around transition for adolescents and young adults in healthcare, and also around that health professional education piece. So that's what we've been concentrating on this financial year, 2022-23. And so in March of 2023, we hosted this particular meeting or workshop. So AYA Transitions Workshop, Improving Safe Transfers of Care into an Adult Health System. And we had the two incredible keynote speakers, Professor Dr. Kate Steinbeck and Associate Professor Dr. Simon Denny, come and provide those keynote addresses around the evidence around transition, but also the evidence and clinical practice that's appropriate and works with adolescents and young adults. So we were very fortunate to host this event in March. We had just over 200 health professionals come in person and online. We were sold out for in-person tickets. And so not only with the keynote addresses, we had several presentations across the day, identify and talk through barriers and enablers in our system, and also participate in the opportunity to, from each clinician's expertise, contribute what they thought was relevant for people, young people transitioning to their part of healthcare, and elevating that expertise to sort of describe it as a whole of healthcare systems level. And so from that meeting, and under the expertise of a statewide transitions working group that we've had during 2022-23, we have created another position statement. And we really hope that this will be a foundation to really advise and move forward discussions in Queensland around what supported transition care is. The position statement presents the evidence. It gives details about what's currently happening in Queensland. But most importantly, it brings together those, 200 clinician views around what are the principles, approaches, practices, and the roles and responsibilities when it comes to a young person moving around within the health system. So this is pending approval. This draft is going to the AYA subnetwork this afternoon, straight after this meeting. So it will be going out for systems consultation in hopefully the next 4 to 6 weeks. And we hope to have this published by sort of early August-ish. The other thing that we've been working on is the health professional education piece. We've been executing this in 2 ways. We have been working with our university partners, and we hope to have some exciting announcements in the near future with UQ and QUT. But I've also been working with 8 incredible young people to create a practice guide for health professionals. So this is really expanding on that very foundational small piece that was as a part of the OPAC strategy, the Optimising Adolescent Young Adult Care in Queensland strategy, and really fleshing out what do young people want to tell health professionals about how they want to be cared for? What are the tips and the tricks, and what's important to them? And so this guide, yes, has been co-produced with 8 young people. We have our last meeting this Friday. They will probably be renaming it as well, but this is where we're currently at with our best shot with the name of it. They will be designing the look and the feel of it as well. So it has been an absolute pleasure to learn and work with these young people and talk through things like communication, consent, confidentiality, psychosocial assessments, youth-friendly environments, flexibility, and partnerships. So it's been an incredible process. Watch this space. Again, this will be going out for systems consultation, hopefully in the next probably month and a half. And we hope to have this published sort of September, October. And where are we heading next year, now that we know that we will have an avenue to execute some pieces? The second key recommendation from the Clinical Senate meeting, and something that was definitely brought up by health professionals and chief executives as a part of the OPAC strategy, was around creating a systems level framework or guide to support health services to better deliver quality care to young people. So New South Wales Health have the role delineation of Clinical Services Guide, which outlines scope, service requirements, workforce and minimum linked services. Here in Queensland, we have separate modules, and these are called Clinical Services Capability Frameworks, and each module is on a specific topic. We currently in Queensland have some children's frameworks, and then do have quite a lot of adult frameworks. And the children's modules really do champion the safety and quality needs of adolescents in health. But with many young adults and many adult services caring for adolescents, those 15 and 16-year-olds that are being seen in whole of life HHSs or hospital and health services across Queensland, what we find, or what we've definitely heard, is that the safety and quality needs of those young people, those adult or whole of life HHSs, don't recognise the children's or the paediatric framework as relevant to their service delivery. We do have frameworks specific to mental health and alcohol and other drugs for youth. That's a sector of our healthcare that's really well developed and quite well embedded. But nothing else that is a broad system whole of healthcare framework that defines care, delineation and best practice for young people within health. So this is pending approvals. We're still waiting to see where this lands, but we have had successfully in the last couple of weeks, we have gotten through another checkpoint in our journey to get the approval to actually start executing this work. Queensland continues to have really strong local initiatives across the state, with some streams and some specific services achieving really great things to meet the needs of young people, and are doing wonderful things applying best practice. So the Queensland Child and Youth Clinical Network are definitely not the only player in adolescent and young adult healthcare in Queensland. But I think that that's part of the reason why, from a systems perspective, levers such as clinical networks or collaboratives of clinicians are really important to continue to invest in and nourish. Our membership is very important to us, and the work of the AYA subnetwork over these last 2 years has been incredible. In Queensland, we also have a new health minister, and she has a very strong portfolio, including women and girls, youth justice in the first 2,000 days. And all of these topics really have a strong prevention and holistic lens, and response from health. So the Queensland Child and Youth Clinical Network are still really working out where is the best fit for this work, and for potentially elevating the strategy in the future to see if we can secure some sort of funding mechanism to actually execute some of the recommendations. But we're still really working out where that best aligns with our current changes within our, within Queensland Health and within the Queensland Government. And that's nearly the end. I just would like to acknowledge the many young people, carers and health professionals that co-design the strategy with us. Without their input, insight, wisdom, none of this work could have been possible. And every stakeholder, organisation, NGO, professional service that contributed to the strategy, it has created something that's quite meaningful, I think, across the system. Simple but meaningful. And we really hope that this sort of, definitely underpins a conversation for the future. So a huge congratulations again to the AYA subnetwork and all the members that contributed their expertise. And we're really pleased we have this strategy and continue to be supported in this work in Queensland. Thank you.
Thanks so much, Brianna. That was really so interesting. And I must say that, it's particularly interesting for me because I'm also in my other job working as Senior Clinical Advisor in Youth Health with the New South Wales Ministry of Health. And so we've been doing, a lot of similar work, I suppose, over the years, and are looking for, we're looking, it's interesting to see different health systems, but how in many ways, even though they have different names to the different parts of them, structures, they're quite similar really. And the challenges to bring, raise the profile, I think, of young people within a health system that, originally was probably not developed with young people in mind. The younger age group perhaps, and the older age group definitely, but not so much the adolescent age group.
Oh, definitely not. And, looking back on how we've evolved as a society and how adolescence has come to be, I know that paediatric healthcare certainly didn't have its own little sector, back in the 1930s and 40s. And, really over the past, 50 years in healthcare, it's evolved to be the incredible system that it is today. And I'm really hopeful that, continued work in this space and, coming after champions such as yourself and Kate and all of the incredible clinicians that do this work with young people, that one day we may move to a system that, really meets the needs of the young people that are coming through.
Yeah, and your work's contributing to that, which is wonderful.
Tiny little bit, fingers crossed.
So we'll get to our questions. Daniel Waller, I think, has got a question, and so we'll answer that. I'll ask that first and you can answer it. Has there been any challenges or benefits of being a population-based rather than condition-based clinical network?
Absolutely. It makes everything so broad, and it makes, I think that there's benefits, there's negatives and positives. So we are able to make, I suppose, all of the work that we put forward relevant to everyone, which is a real enabler in being able to say, that we aren't just a specific piece of the puzzle. I think one of the barriers within potentially any health system, but definitely in ours, is that there are these pockets of excellence that are happening in different streams and sectors, and so therefore they feel only relevant for that sector or that population. So diabetes have done an incredible job of creating really clean transition pathways, between pediatric and adult services. Renal have followed their steps, but other parts of healthcare, haven't, or potentially don't have the actual mechanisms or systems in place to be able to do that. So it's not only about, I suppose, the want and the desire, but it's also about where our system currently is. There's lots of places within the adult health system where young people don't have a mirrored service that they might have in the pediatric system. So that's definitely a challenge for those specific streams. But I think, finding that commonality, and me coming from oncology, to start with, I did do the whole, I'm just a clinician from a small part of oncology. What have I got to contribute? But when I was able to take a step back and think about, the work that's been done nationally and internationally in oncology and adolescent and young adult care, I realised the relevance. It's all the same, and being able to really push that message that we can do this collaboratively as a whole system, I think, has really energised people. To be able to continue, their discussions and their advocacy work in their own specific spaces.
That's great, thank you. Great, so we have another question from David. Where young people, how many were specifically involved in every stage of co-design, including the position state, or were young people?
Yeah.
Were the Queensland Prevention Stream involved? Did you consider the unheard voice in the room?
Absolutely. Great question, David. Young people were really fortunate in some of the mechanisms that we have in order to be able to engage young people in a really meaningful way. Through the AYA subnetwork, we have the opportunity to have 2 paid consumers that are our consistent members of the AYA subnetwork. So those consumers have actually been involved in all of the pieces of work and sit with our clinical experts to be able to participate in all of the pieces. So specifically the position statement, those 2 consumers, as well as a consumer agency called Champion Health Agency here in Queensland, were quite involved in that production of the position statement. With the OPX strategy, we had a project envelope, a funding envelope, and a time frame for execution. And like I said, we did the focus groups in February of 2022. So it was very much trying to take on that coalition of the willing. So in that original phase, there was those small number of young people that we really heard from. And I think that was part of the reason why we actually asked for it to be a longer focus group, to make sure that we really heard from these young people and they had the opportunity to contribute. So there was a small number. There were quite a few more that participated in that statewide survey because of the fact that they didn't want to come to a 3-hour meeting. And again, the survey was voluntary, but the focus groups were remunerated. So there were some systemic structures, I suppose, that stopped us from being able to extend the consultation for months and months, as well as to we only had a finite amount of funding that we could actually allocate to consumer remuneration. But since then, and something I didn't mention, the creation of the practice manual with the young people that I'm working with, we actually, when we re-engaged these 8 young people, we retested the OPIAC data to validate whether or not it was relevant for them. And then we also went out to the Create Foundation, which is the leading NGO of out-of-home care young people here. And we actually held another focus group with the Create Foundation to again ask those questions that we asked in the OPX strategy and see if it was relevant to them, and pull those familiar themes, those same themes from all of those different focus groups. We've definitely reached out to Aboriginal and Torres Strait Islander youth groups, the Child and Youth Mental Health Working consumer group that we have here in Queensland. So we've definitely reached out in hopes that people would be interested in participating in our work. But it is that little bit of, we do have to find a bit of a balancing act, I think, in being able to execute these pieces. It's part of the reason I wanted to spend 6 months working with young people as well on creating the practice manual. I wanted to spend the time to make sure that it was that co-design and that piece was done really authentically, properly.
Yeah, great, thanks. Just a sort of one part of David's question sort of sparked interest from my perspective, and that is how well were you able to engage the different systems within government across Queensland government? So I mean, David's mentioning the prevention health, I think, or population health, or whatever that is called, and and those other, parts, I think, of Queensland Health, and also potentially, cross government even.
Yep. I think in the first phase of creating the strategy, because we're not a new entity, but we were probably newly playing in this space. So there was definitely, that's great that you guys are doing this, but it wasn't a really engaging piece. The Queensland Prevention Stream or strategy branch of Department of Health were incredible at providing really valued feedback in that sort of stage 3 consultation piece, and we're really able to put some beautiful edits into the strategy, as well as other parts of the government and the NGOs here in Queensland. So they were definitely involved in the strategy, the final publication of the strategy. And we've really strengthened our partnership with the youth sector of the Queensland government, particularly since publishing the strategy. I think that the publication is a little bit of evidence that we're a player in the game, and we really are an avenue for any part of the system to gain that clinician expertise on specific topics. So so I think that answers your question.
Yeah, excellent. Thank you. So we have a few other questions. I wonder, Philip, how it is going engaging young males, because typically young females are more easily engaged in a health consultation.
Yeah, absolutely. We do have had more young females, adolescents and young adults that are female, participate in all phases of the work. As you saw in the video, we had 2 incredible young men contribute to the production of the video, and we've had a few more that weren't particularly in that video. One of the young people that's on the current projects identifies as he, him. And so it's definitely not none, but it's not 50-50 either. So we continue to just really promote this. Actually, I should say too that when we put out the expression of interest for the practice manual, because the practice manual, I really wanted young people to help author it. We put out an expression of interest, and we wanted to keep it to a sort of small team, but we had 45 young people from across Queensland apply to be in this practice manual group, and the applications were about 50-50 of young men and young females. And it was just that when we looked at wanting to make sure that we had really good diversity in our group and diversity of experience, that we did end up with a few more females than we did the singular male in our group. So, but the interest is there, and I suppose for me as a person working in this space, it's potentially about me making sure that I continue to consider that as potentially a barrier for young men engaging in this work, and continue to promote and nourish it. So
maybe quickly we can answer Jeremy's question. Can you clarify your ethics challenge? Was it around obtaining approval for the 15-year-old consumers to be able to provide their own informed consent?
Yes, and you've hit the nail on the head. Children's Health Queensland, we, even though we're under the Department of Health as a clinical network, I'm actually employed by Children's Health Queensland, the hospital and health service. And Children's Health Queensland have some policy and guidelines around not engaging a patient independently under the age of 18, and that it would always be through the parents for this particular line of work. So yeah, we pulled out, you know, the definitions around Gillick's competence, and we talked about informed consent, and luckily we did have Dr. Simon Denny, you know, I believe may have participated in a little bit of a hallway chat about our project, and yeah, we were very pleased to be able to offer anyone over the age of 15 the opportunity to apply, and we still received and drafted consent forms for the parents to consent to the participation in the focus group, and facilitated anything the young person wanted. So if they did want their parents to actually come to the focus group or come to a meeting with myself and Dr. Lucy prior as well, we just really tried to meet those young people where they're at with their needs to participate in this work. But we think
that's great.
How can we write a strategy about 12 to 25-year-olds when we can only include 18 plus? That was, you know, our frustration at the time. So yeah, we're really happy that we did fight it. Yeah, and as much as we'd like to include down to 12s, we'll still continue to, you know, be a little bit of a champion in that space. Yeah,
and you've set the precedent, so that's great. Really wonderful. Now we have reached the end of our hour, so but we did have there are a number of other really interesting questions, but I have to draw it to a close. And I'm so grateful that you've joined us today and shared all of the wonderful work that you're doing with Queensland Health. It was really fantastic to hear about it, and I really wish you, and we all wish you, the very best with this new strategy. And yeah, fingers crossed. It takes on a life of its own. So yeah, thanks to everybody for their engagement, and we hope to see you in a month's time for our next exciting webinar. So we'll see you all then. Bye-bye.
Wonderful. Thank you very much, everyone.